My name is Alina. I'm a final year PhD student in the AI4Health CDT.
My name is Avish. I'm a PhD student on Imperial's AI4Health CDT program.
Hello, I'm Lucille. I'm a PhD student in the AI4Health Center for Doctoral Training. I'm in second year of my PhD and I've been working on trying to integrate new AI technologies into helping people after stroke, so who have lost their mobility in their arm, to try to regain independence bit by bit. So how we're doing that, we are I'm using robotics and electrical stimulation. So we're putting electrodes on the muscles and sending short electrical current and generating motion through that.
My PhD is looking at monitoring behavior in households with dementia using intelligent assistive living technologies, looking at motion sensors, door sensors, and bed sensors to try and infer daily routines from movement around the house and sleep patterns, as well as going outside behaviors.
So my PhD predominantly looks at multiomics. So multiomics probably sounds like a bit of jargon, but it's basically molecular data and all these different types of molecular data that we have, how we can combine them.
The ability to make a difference in the healthcare sector, the impact that our research has in real life, real time.
The thing that attracted me most to the AI for Healthcare program was the dual supervision. So when I was applying, it said that you could have a supervisor from the AI side as well as from the healthcare side.
Also, what's really making me so happy to be part of this is that it's really a great environment to be in, because you're surrounded by students who are so interested in similar topics as you are. So really AI for good. So really applying it to the medical field and trying to really make an impact, a positive impact into people's health.
Another factor was the training that the CDT provided to help me develop my skills for my own PhD, and also the wide community that has been built throughout the years that the CDT has existed.
The team behind the CDT is also so great. They're always here for us, for personal issues, professional issues with anything that we can have. They're just always listening. So I think that's also really important, something really important for me.
One of my favorites was the ethics one, because I work with a vulnerable population, and understanding ethical perspectives is an imperative to my work, and therefore this has helped me build the baseline for my PhD analysis and research.
The ones that I enjoyed the most were the ones where it was very self-directed in terms of how you could do the coursework. The ethics module in particular, it was AI ethics, mainly because the coursework was very self-directed. So we got to choose an essay from like a long list of, I think, 30 or so titles, but then you could very much personalize it to something that you're more interested in.
One of my favorite, I have to say, is the one on ethics and fairness and bias in AI.
The other thing was that we could also take elective courses. So we have like 4 modules that you have to take, and then you can audit other courses, which means that you follow along with the lectures. You don't necessarily have to take any exams or submit coursework. And I did that for a course called Biomedical Statistics.
The CDT has its own conference as well, the AI for Healthcare conference. And last year was the first one that happened in Milton Keynes, and it brought together a wide community of students and lecturers from different universities that are from similar CDTs. This provided a great opportunity to get to know what other students do, what the research currently is going towards in the AI for Healthcare sector, and to basically network with other people and exchange skills and knowledge. In the first year, the CDT is encouraging students to go to an AI conference to understand how it works and how it feels like.
So the CDT conference with all the other like AI for Health CDT was really cool, because we really got to meet with students from other cities in the UK kind of studying similar topics.
There are a few other CDT conferences that I went to. So one that was in Cumberland Lodge in Windsor, And we went there, it was with other AI CDT programs in the UK. Kind of a more informal one, mainly graduate students, but it was just good to kind of see the other work that people were doing from similar-ish CDTs.
The CDT offers unique courses throughout the PhD timeline. One of them is the Regulation and Innovation course, which is very applicable and is very interesting from the perspective of getting PhD projects into a final product or a minimum viable product that can go on the market. Understanding the rules of regulation and how to apply to get certifications for different medical devices is very useful in this PhD and through to the future work that is being done using the AI for healthcare research. This course ends with a Dragon's Den competition that brings together a group of students that develop a project and discuss the steps to market. This experience is not only useful and interesting, but it develops a connection between the students and it provides a side of fun to this course.
The CDT offers a research tutorial, which is basically where everyone from one cohort will meet up every week. One person presents a paper that they've been reading, and then we discuss them at the end, ask questions about them. It was quite a useful way to just get to grips with reading research papers, because it's quite a daunting task when you first start out. Just the way that they're structured, it's very different to like reading, fiction, even non-fiction, to be honest, because they're very organized and there's like a set way to read them. But it's good practice to see how other people read them as well, and you can kind of bounce off your feedback together. You kind of learn together. One
that I really enjoyed was this kind of Dragon's Den training. So it's where we had to present a sort of startup idea in front of the dragons. So there were like a group of people from industry, startup owners, people from the policy makers, people from the NHS, also academics. So I think that was a really good crowd, and so we had to present like a concept idea, and I in my group presented a project that was quite close to my PhD. So it's really interesting, and so we presented the project and we worked in group to really put the best out there. Also because I think in the CDT we're so lucky that everyone is doing such different projects that we're really covering a wide range of things, and if some are successful, I think it could really make a change in how we approach medicine and technology together. I think that's really a great learning environment to be in.